Hello everybody, my name is Jafarova Shalmi and today I'm going to talk about shoulder and elbow anatomy. But first of all, I'm going to start with shoulder. So how the shoulder works? The shoulder is the most complex, sophisticated joint in the body because it allows the greatest range of movement of any joint in the body. It has a series of complex muscles and ligaments that keep it in joint. And it's made of 4 joints and 5 linked bone groups, which all work together. To allow movement, the joints need to be free and stable compared to the other joints in the body. Bones of the shoulder. The bones of the shoulder consist of the humerus, upper arm bone, the scapula, shoulder blade, and clavicle, collarbone. Joints of shoulder. 4 joints make up the shoulder: glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and scapulothoracic joint. The glenoid. The ball on the humerus sits in the socket of the scapula. It's called the glenoid. The ball doesn't fit exactly, which allows increased movement, and stability is provided by muscles and ligaments. Glenoid labrum. The socket of the shoulder is deepened by the glenoid labrum. It's similar to the meniscus in the knee, and an injury to the shoulder can result in damage to the labrum-labral tear. Shoulder bursae. Bursae are found wherever 2 body parts move against one another to reduce friction. It contains a small amount of lubricating fluid. Inflammation and swelling of the bursa are known as bursitis. Ligaments and tendons of the shoulder. The structure of the shoulder is given stability by all our ligaments that surround the area from front and back aspects. We have a similar connective tissue known as tendon, which is designed to withstand tension and are both made from collagen, but our ligaments connected bone to bone, whereas tendons connected muscle to bone. Muscles of the shoulder. During the shoulder class, we work on exercises that are going to help support the shoulder structure as a whole. That's why it's so important to look at the big picture of muscles that surround the area too. Exercise can also be felt in areas such as the chest, back, and arm muscles. This is because they pair with our shoulder muscle to provide support and stability. Hopefully, this can make day-to-day occupational tasks pain-free or easier to do because the structure is working well together by not just isolating one specific area to straighten. There are 4 rotator cuff muscles work around the shoulder blade, scapula. These are supraspinatus, infraspinatus, subscapularis, teres minor. Together, this helps to stabilize the shoulder. Here we can see posterior muscles of the shoulder. And here we can see anterior muscles of the shoulder, superficial and deep muscles. Nerves of the arm. Nerves travel down the arm under the axilla, armpit. They are known as the brachial plexus. These nerves carry signals from the brain to muscle to move the arm. Nerves carry signals back to the brain about sensation. Now I'm going to talk about elbow anatomy. And I'm going to start with joints. First of all, I'm going to start with humeral ulnar joint. The humeral ulnar joint is part of the elbow joint or the olecranon joint between the ulna and humerus bones. It's a simple hinge joint which allows for movement of flexion, extension, and circumduction. The humeral ulnar joint is the junction of trochlear notch of the ulna and the trochlea of the humerus. Then humeral radial joint, a hinge joint between the head of the radius and the capitulum of humerus. And radio-ulnar joint, a joint that connects the radius and the ulna. Examples, proximal and distal radio-ulnar joints. Bones. Elbow consists of 3 bones. It's humerus, radius, and ulna. Ligaments. We have 4 ligaments. It's medial collateral ligament, lateral collateral ligament, annular ligament, and interosseous membrane. I'm going to talk about interosseous membrane. The interosseous membrane is a thick, dense, fibrous sheet of connective tissue that spans the space between 2 bones, forming a type of syndesmosis joint. In the upper limb, the interosseous membrane is between the radius and ulna. It divides the forearm into anterior and posterior compartments and also serves as an attachment for several deep muscles of forearm and hand. In the lower limb, the interosseous membrane is between the tibia and fibula. Along with the anterior and posterior intermuscular septa, it divides the leg into several compartments and also serves as an attachment for several deep muscles of leg and foot. In both the forearm and leg, the interosseous membrane may be pierced by vessels. And function, one such structure as interosseous membrane is a fibrous tissue with an oblique orientation from the radius to the ulna. The membrane maintains the interosseous space between the radius and ulna through forearm rotation and actively transfers forces from the radius to the ulna. Muscles. First, I'm going to start with biceps. The biceps trachea crosses both the elbow and shoulder joints. Its action on the shoulder joint is very weak flexion. It works most effectually in flexing the elbow joint when the forearm is supinated, palm facing up. The bicep curl is most commonly used exercise to straighten this muscle. Triceps brachii. The triceps brachii also assists latissimus dorsi in extending the shoulder joint. It contracts strongly during the up phase of a push-up to straighten the arm. Insertion is olecranon process of the ulna. Actions, elbow extension, and innervation by radial nerve. Brachialis. The brachialis acts to flex the elbow, whether in pronation or supination, along with biceps brachii. As brachialis is attached to the ulna, which cannot rotate, it's the only true flexor of the elbow. Origin. It's a lower half of the anterior humerus. Insertion, coronoid process of ulna. Actions, elbow flexion and innervation by musculocutaneous nerve. Uncanalus. The uncanalus is one of small elbow muscles. It works alongside triceps brachii in extending the elbow. It also acts to put the synovial membrane out of the way of the olecranon process when the elbow is extending. Origin is posterior surface of the lateral condyle of the humerus. Insertion, a posterior surface of the upper ulna and its olecranon process. Actions is elbow extension and innervation by radial nerve. Brachioradialis. The brachioradialis muscle acts to supinate the forearm from a pronated position when it flexes the elbow. When starting in a supinated position, it acts to pronate the hand as it flexes the elbow. Origin. It's lower 2 or 3 of the lateral supracondylar ridge of the humerus. Insertion, styloid process of the radius. Actions, elbow flexion, pronation and supination, and innervation by radial nerve. Biceps brachii. The biceps brachii crosses both the elbow and shoulder joint. Its action on the shoulder joint is very weak flexion. It works most efficiently in flexing the elbow joint when the forearm is supinated. The biceps curl is most commonly exercised to straighten the muscle. Origin, long head, top of the glenoid fossa. Short head, coracoid process. Insertion, bicipital tuberosity of the radius, bicipital aponeurosis into the deep fascia of the forearm. Actions, elbow flexion, supination of the forearm, and innervation by musculocutaneous nerve. Supinator. The supinator muscle is an elbow joint muscle, which is used most when your arm is straight and you are turning your forearm outward, or to use the correct terminology, extended and supinating. Origin, lateral epicondyle of the humerus and posterior part of the ulna. Insertion, lateral surface of the radius. Actions, supination of the forearm and innervation, radial nerve. C6. Pronator teres and pronator quadratus. Pronator teres works the hardest when the elbow is flexing the hand simultaneously pronating. The pronator quadratus muscle pronates the forearm and helps the triceps muscle extend the elbow. Blood supply and innervation. The blood supply to the elbow joint is derived from a number of periarticular anastomoses that are formed by the collateral and recurrent branches of the brachial, profunda brachii, radial, and ulnar arteries. Proximal to the elbow joint, the brachial artery, the largest in the arm, gives off two branches, a superior and inferior ulnar collateral artery. The profunda brachii gives off a radial collateral and medial collateral artery. These pass towards the joint, contributing to the anastomotic loop supplying the joint. Distal to the elbow joint, the radial artery gives off the radial recurrent artery, and the ulnar artery gives off the anterior and posterior ulnar recurrent arteries. These arteries ascend towards to the elbow joint, anastomosing with the branches from the brachial and profunda brachii arteries in the arm. These are references from which I took information, and thank you for your attention.